All right, looks like we are live. Hello, everyone.
Hello.
I apologize for having us join. I know we joined a minute late, but this is the voice of and the face of Dr. Tolu Olabinto. I'm the CEO and co-founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm really excited to be having this conversation today. It's a very necessary conversation, and our guest, Dr. Joy. Did I pronounce that right?
Dr. Enjoy.
Enjoy, yeah, enjoy exactly. Is here with us. She's our guest. I'm a big fan of hers. I've seen some of her work on social media, and I thought to invite her on today to discuss recognizing and addressing trauma. We're talking about practical steps for moving forward. Doc, thank you so much for coming. How are you?
You're welcome. I'm doing well. Thanks for having me.
Awesome, awesome, awesome. Now that being said, now before we go ahead, I do need to say this for those watching live replay, hashtag replay. If you know that there's someone that needs to be here watching this with us, please kindly invite them, tag them so they can join us live. Now that being said, Dr. Joy, can you please introduce yourself to us, who who you are and what you do?
I sure can. Well, I'm Dr. Nina Joy Mena, affectionately known as Dr. NJoy. And so I'm a community psychiatrist. I'm the chief medical officer of Chris 180. It is a community mental health center here in Atlanta. And I also am the owner of my own private practice that's Enjoy Life, Living in Full Empowerment. I'm a motivational speaker, podcaster of my own podcast, Journey to Joy Live, which is a mental health podcast, and a new author. I have recently published the NJoy,
Saw that. I
Enjoy
saw that. Saw
Nurturing
that.
Authentic Living. And I am also a mother and a wife. So if you hear any screaming in the background, because I have 3 boys and a husband watching the Mets play the playoffs.
Okay, because that's important. But well, well, thank you for joining us. Now, Doc, why do you do what you do? Inquiring minds want to know why do you do what you do?
Yes. I mean, I feel like it's all come natural this whole time. But as far as wanting to become a doctor, the story of me getting hit by a car at the age of 5, that was my first exposure to the hospital, to doctors and different things like that. Luckily, I didn't have any broken bones or anything and didn't have to stay overnight. But I just remember ever since age of 5 wanting to be a doctor, wanting to be a pediatrician, actually.
Okay.
And so, but when I got exposed to psychology, I think I was watching the Beautiful Mind movie. It's a movie about a man with schizophrenia, and then ended up majoring in psychology. That's when I got really obsessed. Ooh, psychology. This is great. I like pediatrics. I like psychology. Maybe I'll be a child psychiatrist. And of course, that's what I ended up being. But every mental health specialist has their own battle with mental illness, whether it's personal or family or community. So I definitely have family members who suffer from mental illness, substance abuse, which led to that mission as well. And my father passed away a few years ago. He always talked about Joy, you're my joy. I named you Joy. That's your middle name. And I says, I got to live true to that. I got to bring my brand to life. So that's why I started Enjoy Life, living in full empowerment, just trying to spread that joy.
Oh wow, that's awesome. I mean, you exude it. Yeah, I mean, I've watched you, and you smile and all over the social media. I know I
Thank
sound like a
you.
stalker, but here. Now, why so you do have a like why choose this topic? I know I talked to you about it, and could you share from your experience working with patients why this topic needs to be addressed from your experience, and then we'll go into the questions.
You mean why trauma needs to be
Yes,
expressed?
yes, yes. I know it sounds obvious.
Yeah, trauma. We've all experienced it in one way or the other. It can be hidden, it can be obvious. Trauma is definitely important because we need to know how we can deal with it. And trauma has different colors and different faces, different shapes and sizes. I know we'll get into all of that, but it's just definitely very important the way it affects us, and that can affect us in different ways, whether it makes us avoid different things or makes us more over anxious and we're doing too much and high risk behaviors and things like that. So it's definitely important to be able to address it so that we can get ahead of the stigma and get the help that we need.
Okay, that's fair, and thank you for shedding light on that and sharing that too. Um, what are ways to recognize signs of trauma, or you're going through almost like you're living out
Mhm.
something a response to trauma. Because some people may watch and say, no, I mean, this happened to me, but I don't think I'm affected by
Right.
it. But what would you say are some of the
Mhm.
recognizable signs of trauma?
Yeah, and some people aren't affected by their trauma. Some people don't need to see a mental health specialist. But for one, in order to be traumatized, you have to experience a trauma. And a trauma, it depends on that person. But typical traumas are abuse, neglect, abandonment, life threatening situations,
Mm,
car accidents, natural disasters, right? Gun violence, fights, different things, or losing someone, or you had a near death experience yourself, or you watched someone die,
mm, mm,
or vicarious trauma. You learned of someone else's trauma. Of course, specialists can experience that. So, having experienced a trauma, that's the first thing, right? And then recognizing the signs would be: are you different? Are you not sleeping
mm,
all of a sudden? You used to sleep very well, or you're sleeping too much, your energy level is down, or your appetite has changed, or all of a sudden you're avoiding certain situations and you don't know why, or maybe you're like, oh, maybe it has to do with maybe that time I encountered that man or that assault. So you're avoiding, or you're all of a sudden over anxious, looking over your shoulder. We call that hypervigilant. Nightmares,
mm.
flashbacks, reliving the situation. So these are symptoms of post-traumatic stress disorder, where you might notice, like, okay, maybe there is something going on. Maybe I should seek some help.
Okay. Um, and for those of you who are watching, some of these signs, people may have noticed that about you, or you seem a little off, or you seem a little more jumpy, or
Yeah.
you seem moody, or certain triggers
Mhm.
set you off as well. And the reason why, we're having this conversation is saying, okay, how do we move forward? How do we thrive in spite of things we've seen or you experience, right?
Yeah.
Because you can't unsee those things, right?
Right.
So for someone who's watching, who's saying like, I've been through stuff, I don't want to go back there, but I keep, things. There are a lot of triggers that are happening, or I
Yeah.
find myself having flashbacks. Um, any words of hope before we talk about practical tips? Like, have you seen people thrive even with things that they have experienced? Because you can't. I mean, I wish I could just say delete this, let's delete that
I
memory.
know.
What would you say to someone who's watching, who's like,
Yeah. Well,
no,
the words of hope will be that it gets worse before it gets better. And the second part of that is where the hope is that it will get better. The more you process it, the more you think about it, journal it, talk about it. Of course, those emotions will come out, because some people say, well, therapy makes things worse for me. I don't want to go
Mhm.
to therapy. But that's a part of the healing journey, is being able to expose yourself to it heads on by talking about it, not getting yourself back into the trauma, but being able to talk about it, process it, and then getting used to it and developing the coping skills to be able to deal with those triggers. And it will get better. It starts out kind of rough, but resilience comes out of that. A lot of us feel like, okay, these challenges are very difficult, these traumas are very difficult, but learning that you are resilient, and that although you went through that terrible experience that you call a trauma, you actually will grow out of it. So that's really the hope, and inspiring thing, is that you get stronger too.
Wow, wow, that's encouraging to hear.
Yeah.
And I'm guessing that some of our viewers may be veterans,
Mm.
who are watching, who are saying that sometimes loud noises make them jump, and they keep having recurring dreams, and it seems only people who can understand are people who have been in their shoes.
Mm.
So someone who's watching now, who's saying, I meet with my buddies, and we talk about it,
Yeah.
and we exchange stories. Um, are there Do you have suggestions as far as support group settings, that would be helpful for these kind of conversations? I'll be honest with you, Dr. Joy. Sometimes I worry, or I'm concerned that when you keep talking about it all the time with the same people, you're kind of reliving it somewhat. You're laughing it off, but it could be triggering too. Am I wrong to think that? Like, maybe not talk so much about it, but in that setting, I don't know. Is am I
Well,
real?
that's the thing. Yeah, talking about it is re-triggering, and that's the part about therapy that makes things get worse before it gets better. Trauma focused cognitive behavioral therapy, TFCBT, that's the
Mhm.
gold standard treatment for post traumatic stress disorder. And a part of that therapy, you're working on your coping skills, you're working on how to identify your triggers. And when you get to a certain level, what do I do when I get to that certain level? You're working on all those things before you jump into the trauma, because it's the evidence shows that once you jump into the trauma, create that trauma narrative, which means you're literally writing down chapter by chapter
Mhm.
about your trauma, but you are packed with those tools firsthand of how to deal with it when you get into that trauma narrative, so that you know how to encounter it when those triggers get to you. Because so yeah, it's triggering at
Okay.
first.
Okay. It's so interesting. I find that even with these conversations come up, even without those who have a history of trauma. Like when I go see a therapist, I talk about the things that are bothering me,
Yep.
and then I feel like, oh my God, you just unearthed. And then it's okay, see you next time. So what
Mm.
you're saying that this is part of the healing process and it does get better. Right? That's what that's what you're saying.
Well, it's part of it, but a good therapist won't like open up a wound and then,
And it's
okay, see you next week.
okay.
Excuse me. They will make that come out and then work with you to bring that down. And then you're calm before you end the session. So a good therapist would not, have you just like crying and crying. Okay, bye bye. So that wouldn't be how it would work.
Okay. Are there any tips in having that conversation? Because that's a big fear. Like, I don't
Yeah.
want to go see a therapist. So you said this, so I'm able to tell the patients and say, go. It might feel a little, off a little bit. You're recanting the memories, but then it gets better. Are there ways that the our patients or our viewers can help the session to go in a way that works for them? So are there conversation tips you have in because I tell my patients, I say, when you talk to a therapist,
Yeah.
your goal is to get tools so that by the end of the day you have something to work with
Right.
for the next visit. But are there, because I have this conversation a lot and they
Mhm.
say, yeah, I don't want to talk about it. I'm saying, no,
Mhm.
you should. What
Yeah.
are the tips, doc?
Well, talk about it when you're comfortable. I mean, when I see patients, some patients are ready to talk about stuff on day one and some aren't. So I ask the questions and I say to them, you can list the trauma, you can go into as much detail as you want to, or you can just say, yes, Dr. NJoy, I've had trauma. I'll talk about it when I'm comfortable. So talk about it when you're comfortable. Nobody is going to force you to talk about it. But what makes therapy work is at least having some type of goal when you go in, as far as like, okay, I want to work on this thing, I want to work on that, having some type of goal. Because a lot of people I speak with who have therapists, they're like, oh yeah, we just talk and that's it, it's just nothing. I'm like, you could be talking to a girlfriend, but you got to
Right.
make therapy work for you. That's one of the reasons I created the NJoy is to help with therapeutic techniques and worksheets and homework for people to do in between therapy sessions, or for people to do when they don't have a therapist. But definitely number one is having a goal. And of course, when you feel comfortable is talking about it. If you don't feel comfortable, it's really difficult. But a good therapist will help work with you on that, so that you're not waiting 3 and 4 years of therapy before you actually get into it.
Awesome, awesome. All right, so that's one big tip. Can we talk about other practical tips when it comes to addressing trauma? Tips for moving forward. You said a lot, but I want us to kind of number a few and go from there.
Right. Yeah. I mean, self-care in general goes a long way. So, taking care of yourself, making sure you're taking care of your physical health, because physical health can impact your mental health. A lot of different types of aids can help you with that. So, like making sure you're getting good sleep, sleep hygiene, making sure you're working out, healthy eating, all those things wrapped together. Because if you're not taking care of your body and taking care of your physical health, then that can impact how you respond mentally and how you respond to therapy and things like that. So self-care goes a long way. And self-care, I mean, it's not just in physical health, it's also in our financial health, our social health,
Hmm.
being able to connect with the community, connect with your family, connect with friends, having someone that you can relate to. You mentioned earlier that, for people who've been in the military, they can connect better when they've been able to be around people who've experienced the same things as them. Of course, when it comes to trauma, it's, sure, being around people who may have experienced the same thing can be helpful, but also being around people who might be more resilient and been through those things and come out of it and had those successes can be really helpful too. So, like I said, self care can go a long way. And of course, taking care of your financial health. I'm going through down these things. These are things that I talk about in NJoy as well, are taking care of our mental health, physical, financial, aspirational health, as well as our social health. So as far as what aspirational health is, it's like thinking about your life and your purpose. Because one thing about trauma is that what are we doing? We're living in the past. We're
Yes.
thinking about that trauma. We're letting it haunt us. And I have chosen that word wisely when I say let's, because some people might say, well, I don't have any control over it. To a
Right.
certain extent, you do have a control over it because you can choose to work on it and you can choose to look forward and choose to find those techniques that you can use to get through it. So, of course, you're not the one that's traumatized yourself and you're not the one that's making yourself have these symptoms. But once you choose, I'm going to get through this, changing that mindset, getting on that journey towards joy, it is a decision that you can make. But yeah, moving forward and thinking about your future and what you want to do with your life, your aspirations. So that goes back to that aspirational health. It's really important.
Wow, that's powerful. So kind of looking forward, having something that takes your attention powerfully forward.
Hmm.
So it's
Hmm.
like
Hmm.
focus, look forward to. That's
Yeah,
powerful. That's powerful.
we
And you
we
are
trap ourselves by our trauma because we're used to that. That learned helplessness. Sorry, go ahead.
girl, shoot, I'm gonna have you back on. This is good. This
I
is
got
good.
more. I got more. If you want.
This is good. So and I love your straightforward approach.
Yeah,
And this does not by any way take away from the pain of your experience. It's
correct.
life is going, and this is where I get kind of passionately angry on the behalf of the person. Like, how
Yeah,
do we move forward? How do I help you enjoy the quality of life that you want with the life that's left ahead of you? All right.
right.
And that's the goal. And that's
Yeah.
why, yeah, the way forward conversations keep happening.
Mhm.
Not to downplay what has happened to you. So it's wow, that's powerful. And then something else you said addressed the question I had earlier. The community. So
Mm.
it's good that you have a community where you're talking to people who have gone through what you've been through, but it's important that they are being able to kind of come through it so they can promote.
Mhm.
So otherwise,
Pay it forward. Help somebody else.
right,
Tell your
powerful.
story. Nobody likes to hear from someone who's had the perfect life. People want to hear from people who had issues and trauma and stress and got through it. That's the story they want to hear.
Awesome, awesome. Now I have someone asking a question here.
Ooh.
Very good question. He says, sometimes when you're sure someone is going through some, like responding to a history of trauma, but they refuse to admit, how can you offer help without them getting offended?
Right. I mean, ask them what they want out of life. Ask them what they strive for. Because I have those questions a lot with my patients who they might be deeply depressed or suffering from a severe trauma, but they don't take my recommendations. They don't go to therapy or they don't do their therapy homework or they don't try to do the positive affirmations. Journey to joy. I'm always talking about joy and reframing your mind and thinking about things positively. A lot of people think that's so fluffy, but a lot of people don't want to take that advice. Like, I'm not going to think positively. What's that going to do? Well, negative thoughts work. They make you feel bad, and positive thoughts work too. They make you feel good. So, with that said, when someone is just refusing, it's kind of like meeting them where they are. So, what do you want? Because most
Mhm.
people aren't going to say, "Well, I want to continue to feel bad. I want to continue to be traumatized. I want to continue to be stressed." They might say, "Well, I don't even know what happiness feels like," and you can walk them through that, what it could look like, and walk them through encouraging them, and just say, "You know what? Maybe." Maybe it won't wait, maybe it won't happen right away. It's not overnight that it's going to happen, but you will get there. You may not know how, but you will get there. And just being there to encourage them and give them the resources that they may not know are out there.
Okay, thank you. And that's a very good question. Thank you for asking. So,
Mhm.
this has been very rich, and we're definitely going to have a part two. I'm not happy that we didn't start early, but we're here, so this is good. But I have someone who's watching who's saying, "Yeah, doc, I hear you. Clearly, I mean, it's obvious I've been through trauma. I'm not doing so well. My life is kind of meh. Where do I start? Like, how do I advocate for myself at my doctor's office? Do I go and say, "Hi, doc, I have a history of trauma and I need help"? But what would you say to that person who's saying, "Where do I start? Where do I begin?" I hear what you're saying, Dr.
Mhm.
Joy. I'm going to look for your journal and try to get it and try to apply myself and look for ways to help me move forward. But for that person who's watching, who's wondering, where do I start, doc? What would you say?
Well, that's perfect. I mean, you said it all. I mean, if the person is like about to get the journal and about to start therapy and things like that, that's all you need to do. And the therapist will help you walk you through that. If you need to see a psychiatrist and you start on a medication, take your medication every day. Be compliant. If you have side effects, talk to the doctor about it. Don't just stop it, because maybe if you stop the medication, it might make things worse. So talk to the doctor, communicate with the doctor. If you don't like your therapist because the therapist isn't providing some good amount techniques, or you just feel like things are the same, that's okay. Finding a therapist is like finding a mate and dating. They are human. Just because therapy didn't work out for the first 5 therapists, it doesn't mean it's never going to work out. It's going to work out.
Oh my
So
God.
yeah, if you're talking about somebody who's already trying to get into therapy, that's where you start. I mean, and of course there's what I call less than therapy techniques, right? Things that anyone would do. So like keeping up with what I said earlier, especially exercise. Exercise goes a long way. I'm an avid runner. I run almost every day. That's my therapy and my medication. If I don't work out, my anxiety level is like going back up, my stress level is going back up. So know what that thing is for you, where you got to have it and continue to do it. It takes work. Our journey to joy is work. It's not going to come easy. So knowing that and keeping up with it, that's the start.
Shoot, you a true teller, man. Shoot, you tell it like it is. I love it. She's like, it's work.
It's
It's,
work. Yeah,
it's not
because you,
sugarcoating it.
yeah.
It's work, but it's good work, and
Hmm,
it's work.
hmm.
It's worth the inconvenience of it. Doc. So has been very, very good, and I know people are watching. And thank you all for watching. I see you all on YouTube, Facebook, um, and they're wondering, Doc, how can I connect with you? I like how you keep it real. I like how you ooze what you're talking about. I like how you talk about the possibility of thriving even
Hmm.
with history. Could you tell us where can we find you, Doc?
I'm everywhere. Well, you can't find me on YouTube, Dr. NJoy Life MD. And anytime I say enjoy, it's just an N, not with the E, and doctor's DR. I'm on Instagram at dr.enjoy.life, Facebook at Enjoy Life. And my podcast is everywhere. It's iHeartRadio, the Apple Podcasts, Spotify. It's on Pandora. It's yeah, I'm everywhere where I can be, because the point is to be able to spread that joy and to get people talking about uncomfortable things. We got to get comfortable talking about uncomfortable things and just knowing it's okay to not be okay. So I'm everywhere. You can get the Enjoyno for $39.08 on Amazon.
Oh, I need that link. Enjoy no. So it's
Yes,
and what's the name of your podcast again?
it's called Journey to Joy Live. My website is pretty much the hub for all of what I'm talking about. The website is drenjoylife.com. So www.drenjoylife.com.
Enjoylive.com. Enjoylive.com. All right. So I've put it all at the bottom of the screen. Usually I have help, but today I don't have help. So bear with me,
Oh,
everyone.
gotcha. What could you do with all this?
Shoot. No, what you do is powerful. I need people to watch and see that get connected to you. So I put it at the bottom of the screen
Oh,
and
life.
life. Okay.
You Journey to Joy Live is correct. My website,
So, life.
drenjoylife.com. It said live. That's okay. I think y'all will find me. Just type in Journey to Joy Live by Dr. Enjoy. It'll pop up.
All right, I'm gonna fix it later, okay? But
Okay,
you get the
awesome.
idea. And get her journal. I got my copy. Well, I mean, I
Hey.
ordered it. I ordered it. But Doc, can we do this again? And I'd like to ask you live, so you can't
Yes.
say no.
Yes, please. This was too quick.
I know. I agree. We have 4 minutes. I agree. And And we'll start earlier because this is good. This is powerful. I know people who are going to watch this live, who watch this live, who watch this replay are going to be blessed by it. This was powerful. There's hope, and it's work. But we are ready to do the work. We're encouraged today, and we're challenged too as well. Doc, thank you so much for coming.
Thank you for having me. Appreciate you.
Yes, ma'am. Yes, ma'am. Now, thank you all for watching. Thank you, Ezekiel, for asking the question. And as always, Karen is sharing. Please forward this, tag someone in the comment. And if you want to do this privately, you can always share this link to them through YouTube so they have access to watch the video. As always, thank you all for joining me. If you or anyone you know is looking for an awesome, a thorough, and compassionate family physician who have conversations like this to help you live long and well, you know it. I am she. Thank you so much. Doc, hang on one second. Don't leave, okay? I want to chat.